This is a press release that will be issued through the Medical Journal of Australia on climate change and obesity. Dear Editor, as health professionals, we urge Australian politicians and the public to recognise the overlap in the underlying cause of two great health threats that our population now faces: the rise of obesity and its life-threatening disease consequences, and the great threats to health from global climate change. Big health gains have been made since the onset of industrialisation. However, we are now seeing the emergence of health risks caused by excesses in market-driven consumerism, including energy-dense processed foods, energy-subsidised exertion-free living, an overarching GDP fetishism, and, for climate change in particular, population growth. In light of our profession's long experience of the smoking disease debate, we recognise the serious threat posed to population health by a well-financed, doubt-fostering opposition of vested interests. For smoking, it took 50 years and several million deaths to go from acceptance of the health hazard to application of effective interventions. With climate change, we lack the luxury of time, and the stakes are much higher. Hence, a prudent, precautionary strategy to tackle the big issues is essential. We propose two initiatives. One, convene a high-level, ongoing forum to discuss post-growth alternatives to unsustainable, consumption-based growth as the economic norm. This should involve health and social scientists, amongst others, and economists prepared to objectively take into account the real environmental costs of our actions. Number two, convene a multidisciplinary task force to develop an Australian population policy. Population is a key driver of energy use, greenhouse pollution and resultant ill health. Despite the apparently widespread bias against public discussion of population, the topic is now attracting renewed attention and the debate should be facilitated. The irony of a no-change approach to these two issues is that if this happens, involuntary change to everyone's lifestyle will become unavoidable. We must seek a sustainable economic system and stable population size that ensures prosperity without endangering both health and environmental quality. For the moment, our actions are seriously damaging our planet and our children's health, 1 in 3 of whom born today will become obese and/or diabetic in their lifetime, while the population at large will face increasing health risks from climate change. And this is signed by 4 signatories: myself, Professor Boyd Swinburne from Deakin University, Professor Fiona Stanley from the University of WA and former Australian of the Year, and Professor Karen Phelps from the University of Sydney and former President of the AMA, plus over 350 other signatories, of whom 50 are professors of medicine or health science. The other 300 are GPs or health specialists working in this area.